I would like to try and share with you something which is my inner balance screen. And I know that you bought this after I spoke with you, and you've achieved some impressive results. The Inner Balance is a heart rate variability app that I've just turned on. I've clipped onto my earlobe, so you have this as well. I'm just going to clip the other side into here. I'm Bluetooth connected to my iPad. And what I'm going to show you, and maybe you can talk me through as the expert user,
Sure.
is that it's scanning for it and the sensor is found. And what Natalie is going to tell you now, because she uses this, is she's going to say that I'm following the breath on the breath pacer here. Is this familiar to you?
Yeah, you can see this at the top, the little ball moving around. Now you're breathing in, and then when the ball is on the other side of the screen, you'll be breathing out again. And below you can see a graph which measures heart rate variability. And the goal is through breathing to get into a state of coherence, and not just through breathing, but also through channeling positive emotions, maybe an appreciation for someone that you care about. And actually, I can see that you'll be getting into high coherence soon, because your graph is looking like a nice sinus wave. So that blue dot that we see there right now, it will be turning green. There it is. It just turned green right now. And on the top left, you can see the coherence score 4.59. That's already very good, and it's going to increase even more. And yeah, what that does, that slow breathing, for me anyway, it helps me activate my parasympathetic nervous system, and it makes me feel calmer, and sometimes even can calm my heart rate down sometimes.
Natalie, I didn't train you on this. Oh my goodness, you just nailed it. So what Natalie's just described to you is a phenomena where at the beginning of my breath technique, my heart rate was in the 90s, and it was not so much the heart rate, but actually the heart rate variability profile was doing a bit of this. The moment I slowed my breathing down to a 6-second cycle, remember that ball going left and right? I was following that in, going this way, and out breath going that way. You could see I could immediately control heart rate. So this is a very, very powerful demonstration of direct control of your autonomic nervous system. Because you remember I said you can't control your heart rate. How can you think of reducing your heart rate? Well, it turns out you can. You can control your heart rate. And if your dominant symptom, Natalie, is palpitations, I would urge you to continue practicing your heart math in this way. For example, 10 minutes when you wake up, 10 minutes before you go to sleep.
Yeah.
And ensure that before you practice, you are in a calm mental state. So you said, think of something positive. And gratitude is one of the most positive emotions that you can couple with this breathing technique to get this very nice, coherent sinusoidal state. Now, I got there fairly quickly. I don't know how, but it just came. And it's because you put me so at ease. And I didn't have to think about talking through it, because you were talking through it so nicely. But what we're looking for is actually this pattern, Natalie, a sinusoidal pattern, rather than this jaggedy pattern, which is the pattern of somebody who's not coherent or at stress, or when there's too high an autonomic state. And this sinusoidal pattern that I've just drawn is something that should follow a slow, deep breathing technique, ideally through your nose, in and out, for 6 seconds in and 6 seconds out. This pattern of heart rate variability, when you are in a stress or fright or flight mode, looks like this. When you're frustrated and angry, or when you have autonomic dysfunction and you're standing up, it's very difficult to calm your heart rate. But if you're frustrated, this is the kind of difficulty in regulating the wavefront. So it's not the heart rate itself, it's actually the pattern of regularity, you see here in the heart rate. And I would urge you, if you can, to kind of read this blog, which is available on my website, called Top Morning Tips for Increasing Focus and Energy and Dialing Down that Fight or Flight Response. It takes about 8 minutes, but there is talk about waking up and feeling or doing a gratitude list, which is what I still do to this day, and what I would like to achieve. So a manifestation wish list. And for you, it could be, I want to run, or I want to cycle, I want to go out for a walk, and I want to feel better. And then the third thing is we talked about is the heart math, which could be 5 minutes or 10 minutes. A simple 8 to 10 minute routine every day may well dial down that fight or flight response. We talked previously about some of the things that we were doing to try and help. And if I looked at this now, there's one other thing which I don't know whether you were able to do or not. Let me ask you, did you do compression or not?
I did do compression. I have ordered the ones, I got them prescribed through my GP actually. I think Sigvaris is the brand, that's what the brand's called. And I've got the ones that go all the way up to the tummy from the toes. And I think they do help. I haven't noticed like a massive difference, but I think it's just an added thing that helps, I guess. All these measures probably add up together.
I think just to finish off on the compression, there are two modes of compression. One, you discuss the lower limb compression, which goes from your toes or your ankles all the way to your lower waist or your navel, or to your upper thigh. Those two compressions are fine. And what compression does is it puts some squeezing into your, it squeezes your veins externally. And this compression stockings push blood back up. And just like your muscles that are compressing when you cycle or when you squeeze in a form of exercise called isometric counterpressure exercises, compression externally can also help. But one thing that I may not have explained to you, and this might be new to you, is to try abdominal binders, which will be easier to fit. But the abdominal binders are some things that you can get, for example, by Googling or going to Amazon and buying something from Everyday Medical, which is an umbilical hernia binder with a Velcro strap that can tighten round and can give you more or less compression. And this will be helpful in squeezing the blood that is pooling in your gut. We haven't talked about your guts, but your gut as well can be a huge reservoir of blood, which I'm drawing here. And any help with compression of your gut can push the blood back from your capillaries in the gut that are the size of a football field in surface area. Imagine that. So you can lose a lot of blood after a big carbohydrate meal. All that can be compressed, or not all, most of it can be compressed back to maintain a decent cardiac output. The other thing is, have you tried changing your meal times or meal quantities? So for example, low carb meals, Natalie.
Well, I did notice the carb heavy meals would make me feel worse. So I've tried to be a bit more mindful of that. And what I'm doing at the moment is I'm trying to eat all my meals before 4 p.m. because I find that I sleep a lot better when my body isn't digesting. So when I've had a long time without eating before going to bed. So I try to eat smaller meals so that the system doesn't become too overloaded.
That is absolutely right. And one of the key things I would say is really to reduce your food intake at dinner time and have an early dinner 4 hours before sleep. Because when you start digesting, what happens is that the blood necessarily needs to be taken into your gut here. And these blood vessels completely fill up. And so even when you're lying down, your heart is emptying. So contrary to what you think about gravity, this is now food and digestion starting when you're trying to sleep. Not a good process for autonomic dysfunction. So exactly as you say, and coming back to the prevailing problem you still have with the nighttime sleep, I think those are going to be some of the fundamental things that make you better. One top tip, which will lead on to what you asked me to discuss, is cool, keeping cool. And I find that drinking a cold glass of water, maybe half an hour, 15 minutes before you sleep, just to cool your system down, can be helpful as well, especially if you're so wound up at night. Because imagine you've been fighting or flighting all day. Adrenaline is rampant and has been throughout the daytime when you've been sat on your PC or being upright. And I, by the way, I consider sitting down being upright. And all the time we're pooling. So I'm shaking my legs now. You can't see, but I'm squeezing my buttocks, and you can see me bounce, can't you?
Maybe I should do that too, yeah.
Gluteal tension is actually helping to squeeze the blood. And if any of you are watching this, know that you can immediately boost your focus if you suddenly squeeze your calves or suddenly squeeze your gluteal or your buttocks. And you might just feel, I don't know if you feel it now, I can see you doing it. You suddenly feel an invigorating kind of flash of blood or oxygen in your brain because you're increasing cardiac output. So it's one top tip for combating the postprandial sleepiness. Prandial means after a food, okay? So let's talk about Wim Hof. I'm glad you introduced him because I happen to be a fan. I don't necessarily prescribe him to my patients because there's not enough evidence, but anecdotally, I feel very invigorated when I have a cold shower, which I've started to take religiously since October.
Yeah, I have to say, and I can add to these anecdotes because actually sometimes I found it, but obviously this is just my personal experience, sometimes I found the breathing exercises, so you essentially hyperventilate for 30 breaths, take in lots of oxygen, oxygenate your body, and then you hold your breath, and then your heart rate, which goes up when you're hyperventilating, slows down when you're holding your breath. And then I can hold my breath to up to 2 minutes without feeling like I have to breathe. And then I repeat that for about 2, 3, 4 rounds. I do that either in the morning or in the evening, or sometimes both. And what it does is it helps me slow down my heart rate. It's the most effective out of all of the techniques. It doesn't last very long, and it works best on an empty stomach, I find. But when I do it, it almost works like wonders. And what it does also, it makes me tolerate the cold a bit better. So what the other component of Wim Hof is to have these cold showers or expose yourself to the cold. And I find that it's much easier for me to acclimatize to the really cold water. And that again is it's not really a shock, but it creates almost a controlled adrenaline response, which then again makes it easier for me and for my autonomic nervous system maybe to regulate itself. I don't know. You will explain it better.
So Wim Hof is WIMHOF. We can put the links at the end for those people who are interested. But Wim is a Dutch man who has discovered his own tummo breathing, TUMMO, which was seen back in the early kind of 20th century by explorers going to the Himalayas, where they saw monks meditating in the cold for hours or days on end and generating heat, where the snow would just melt ice off their body and they wouldn't be frostbitten like most of the explorers in their super kit. So Wim has discovered that almost independently through a practice of self-breathing, and you can read this in his book. But my own take on that, with a physiological slant and understanding a bit about the autonomic nervous system, is that imagine you are a hunter-gatherer, and all what is natural for you is you're gathering something, and then suddenly you're confronted with an autonomic challenge. And that is, let's say, a saber-toothed cat or a bear jumping out of the cave. Now, you are bound to and you need to generate a very, very strong fight or flight response. But if you can outrun the bear and you live, or if you can kill the bear because you fight, then you bring it home for dinner into the village, you should be able to completely wind down and have a feast that means the villagers all eat and then you sleep for 24 hours. That should be, or that is the primitive way of being. And if you look at pythons or animals in the savannah like a lion, they make one kill in 3 months and that's it. So they are always in a constant state of more relaxed with intermittent bursts of sympathetic nervous system when they need to make the kill, right? Now what Wim Hof does and what the cold shower and the breath hold does is that it really strongly activates the sympathetic nervous system, and it gives you like a cold shock response. So all of a sudden you're getting this surge, like you're fighting this fright of the saber-toothed cat. But you know what? Once you finish the shower and you come out, you can wind down. And it's this process where you can wind it down, which is what you said to me. Your ability to dial up and dial down is training your autonomic nervous system to not only upregulate quickly and then downregulate quickly, but over repeated training, you can get a sense of calm and come back to what I call our primitive natural state. You know what is unnatural? What is unnatural is I've got this stupid device next to my bedside that I'm checking all the time. The first thing I wake up, I look at it. Before I go to sleep, I look at it. I'm reading news. Apple do a very nice news bulletin and you flick, 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 and then suits. Before you know it, an hour has passed. So I've stopped this habit and I put it on airplane mode. And if I can, I put it away from my bedside. Because all this news and emails and Instagram feeds and whatever else we do is constantly giving us a low trickle of this saber-toothed cat fight or flight. And so the other way to live is to live knowing that we are in a very unnatural state. And what more to accentuate that than your long COVID status? Because your long COVID status is giving you such a heightened, constant adrenaline rush that you don't need to be working in a whatever 13-hour job or 16-hour job. You don't need to be in social isolation. You don't need to have any of these additional risk factors. You're already getting orthostatic stress. But can you imagine if you amplify this with all the other factors we talked about, especially our phone, our TV, and everything else that keeps us on high alert? This will accentuate the worst of the autonomic dysfunction symptoms. And actually, coming back to your point, it would appear to me, and this is probably new to you, it would appear to me, Natalie, that since we last met, you've made great strides. You've come off your beta blocker, which is great. You're exercising 40 minutes a day, 6 times a week. Now, I look at that objectively as your doctor. I think she's making good progress. You're drinking, you're salting, you've just got the exercise on a bike, fine, that's quite recent, but you're getting your compression, you might get abdominal compression, and you're in a positive headspace. I think your trajectory is going to go phenomenally good. And anyone else watching this, if they look at the principles of management here, and then you add in the wonder of thought, emotion, feelings to dampen down that autonomic nervous system, plus breathing, which you've started to do, and I know you told me your coherence can reach 6.5. That is a very, very high and excellent level of coherence. Try and get that twice a day, every day, because that will eventually train your vagus. And when you do Wim Hof, that will train your sympathetic nervous system. So it comes up, but then it shoots right back down when you come back out of the cold shower because you removed yourself from the threat. Does that all make sense?
Yeah, absolutely. And maybe another thing that's really helped me was you recommended that book to me, James Nestor, Breath. So I downloaded an audiobook of that, and when I went on gentle walks, which I did from time to time, I would always put that on. And yeah, he's got some good pointers. He talks about Wim Hof as well, actually.
Yeah, so he does. I mean, my favorite book of the year so far is Breath by James Nestor, and so I quote that for a lot of my patients with autonomic dysfunction to read. And I guess the takeaway message from Breath is that there is a perfect breathing cycle. This is the breathing cycle that are used by kind of nuns with their rosemary beads, or by mantra people who are meditating using mantras, because when they speak the mantra or they say it in their minds, it anchors the breath. And that breath, the perfect cycle, is 5.5 seconds. I don't know whether you read that from the book.
Yeah, I did. Yeah, that's what I set my heart math to. I think 12 seconds I set it to. So 6
seconds. Yeah. So most people do 6.6, but I feel more comfortable actually on 8.8, which is strange because it comes out of the perfect breath. But I think it's a variable thing. You breathe in whichever way you're comfortable. But James Nestor says 5.5 seconds is the perfect breath in and out. So an 11-second cycle is what it should be. And that's effectively 5.5 breaths per minute. It's a lot slower than most of us are taking. So just the mindful breathing on a day-to-day basis, whenever you catch yourself doing nothing or just watching TV, breathe slower. And I think that breath slowing technique that I showed you with my waveform, the waveform on inner balance, could really help anchor your palpitations or minimize the palpitation sensation, because you are trying to bring it down. With every out breath, you bring it down. And when you gain this variability and a high coherence, you're in control. You're in autonomic control again.